mouse isn't connected.
I mean, not the mouse, laptop mouse.
Point, this cursor needs to be on. There's a progression bar if you can turn that on. Thank you so much. So, after we made a side port, we went ahead and inserted a 7 vicryl suture inside in hope of blocking, in doing an internal tube ligation. So, but then post AC formation, the AC was shallow but formed now. There was no tube cornea touch. Finger tension was still soft. The fundus still showed choroidal detachment. So now we planned on closely observing this child. 3 days after the AC formation, however, the AC was once again flat and there was tube cornea touch. Finger tension was soft. Choroidal detachment still persisted. So now we planned on AC deformation again, but this time with ligation of the tube after opening the conjunctiva and to look for peritubal leak. So once again on table, first we stained with fluorescein dye, but then we didn't see any peritubal leak as such. And later on we made a side port and injected trypan blue dye, but then as you can see, no dye is really entering the AGV tube. So we realized that AGV is not the source of the problem, but it is the choroidals that is causing all the issue. So we started the patient on tab propranolol 15 milligram BD after consulting with the pediatrician. After 4 days, the AC started to deepen. On 3 weeks follow-up, the AGV was in place, no tube cornea touch, AC formed, IOP of 14, and the fundus showed no choroidal detachment. 2 months follow-up, BCV of 636 and 24, AGV in place, AC formed, IOP of 14 and 18, fundus showed advanced cupping but no choroidal detachment. So there's a study by Dr. Shushmita Kaushik on perioperative propranolol being a useful adjunct for glaucoma surgery in STURGE-WEBER syndrome. It says oral propranolol seems to be an effective method to minimize the development of sight-threatening choroidal effusion after glaucoma surgery in STURGE-WEBER. A dose of 2 milligram per kg body weight is used 1 week before and 6 weeks after the surgery as per this study, and that's what we did. So to conclude, glaucoma associated with STURGE-WEBER syndrome is difficult to treat. It's prone for complications like expulsive choroidal hemorrhage and choroidal effusion. Oral propranolol can be used routinely to reduce choroidal effusions. Thank you.
Thank you, Dr. IPSITA. Any questions from the panel?
Why did you not do a preventive
Worked, and after that we have actually done few more without any posterior sclerotomies in STURGE-WEBER with just propranolol, which have worked very well from the beginning without any choroidals.
So, IPSITA, basically with propranolol, there's no large case series reported. So we are just taking a risk by avoiding the prophylactic sclerotomy. And till, we are not sure whether, but it is not very easy to manage. So it is a nicely managed.
Thank you.
nicely?
Thank you.
Nice.